our system today remains certainly a highly fractured, costly, poorly coordinated approach to care delivery. The goal, the objective, the catalyst essentially behind the Affordable Care Act is to move the system towards becoming a highly coordinated system of providers supported by a common electronic backbone, compensated on outcomes based on efficient, high quality and service while broadening access to care. This is the fundamental catalyst to how healthcare organizations are mobilizing and evolving to deal with the different environment that's part and parcel of a post-Affordable Care Act. And I think never before in healthcare has there been so much fundamental change, so much uncertainty, and as a result, a tremendous amount of risk in the system that healthcare organizations and providers are aspiring to quantify, manage, and or transfer. Therein obviously resides a tremendous opportunity for our business of helping them manage that risk. Cost fundamentally is one of the biggest, if not the biggest, single concern of healthcare CEOs across the country, and how to manage risk to uncertain cost. There will be 14 million newly insured by 15, 30 million by 2022 if the Affordable Care Act continues along the trajectory that it has established. That in and of itself is an incredibly important and impact dynamic for the industry. That's pent-up demand. That's people who have underutilized the system. That's people that don't have access to primary or preventive care or who haven't historically. That will certainly reveal the shortage of primary care and other outreach capabilities, but these newly minted insureds will begin to move into the system and certainly exacerbate existing resourcing constraints that are part of today's healthcare delivery, and there'll be increased regulatory oversight and enforcement. How will successful organizations adapt? Fundamentally, the view is, and what we're seeing across the country, the key strategy that they will deploy to accommodate all these competing priorities and challenges is integration. They will look to achieve an essential market position to drive revenues and achieve scale. As all this is happening, as healthcare organizations evolve and adapt, so must the approach and capabilities of the healthcare insurance marketplace. And interestingly enough, today's healthcare liability marketplace, while closely tied to the structure of healthcare delivery, is fragmented as well and is handled in silos. There are 200 licensed insurers, but more often than not, the industry is characterized by the participation of monoline specialists and single state underwriters, physician-owned or controlled. The industry in many ways, by and large, not exclusively, looks less and less like the kinds of organizations they need to respond to. And I think that's the fundamental flaw in the system. I think the essential premise that we talk a lot about and really has been one of our strategic imperatives is that the nexus of risk has changed. The nexus of risk doesn't necessarily automatically reside with the physician or with the hospital or identified with the managed care organization. It often sits at the intersection of all of that activity, and it's very hard to identify specifically what the proximate cause behind that liability is as these organizations pull all these functions together. So this, to me, is a fundamental challenge for the industry to be able to identify, evolve, and adapt to, just as healthcare organizations are. Our industry needs to be able to deal with this complex delivery. They need to be able to respond to broad, multi-state geographical footprints, multi-hospital systems, outpatient clinical services, physicians, managed care, complex at-risk reimbursement modalities, long-term care, self-funded employee health care benefits, and other sophisticated risk transfer vehicles. These are all the issues and vehicles that healthcare organizations are looking to adopt and advance, and that our industry needs to be able to recognize and respond to accordingly. Our view is we bring a unique approach to this evolution and these dynamics. In fact, in many ways, the practice has been built upon a premise that this was the direction that healthcare will go with the Affordable Care Act or without. Importantly, it's not the breadth of the product suite alone that will allow us to continue to be relevant to healthcare buyers. It's our ability to beg and borrow solutions and aspects from one product and put them into the other to respond in a way that's as integrated as the way that care is being delivered. As healthcare continues to evolve at an unprecedented rate, with all the variations that we talked about, our view is that it's incumbent upon us to listen, explore, probe in order to develop innovative solutions for today's needs as well as those that may be on the horizon. Thank you very much.